Good morning, afternoon, and evening for the participants that are around the world. We welcome you all to our second Red Cross and Red Crescent Menstrual Hygiene Management Experience webinar. And we want to ask all of you to mute yourself, some ground rules that we want to share with you. Please keep your microphone mute. And as well the camera if it's possible, so we can have a good internet connection for all the presenters. Please, during the presentation, send questions through the chat box by selecting to everyone, or if you want as well to share at the end, we will have always our when we end each of the presenters' presentation, we will have questions. You can raise your hand if you want to ask any follow-up question to our panel of speakers today. We will run as well some polls during this webinar. Please, if you don't want to answer the poll on the question at the moment that you receive the poll, you can always move the questions to the side and keep watching and looking at the screen from the presenter. But the questions are very, very easy. So please, we want that you are active doing that and answer to our easy questions. So what is our agenda today? We will have 1.5 hour session today. We will start with the experience of Malawi Red Cross in rural primary schools in Malawi. And 𝗖cie will talk about knowledge, attitudes, and practice concerning, oops, this is moving, excuse me for that. It's moving the screen now. Yeah, so 𝗖cie will talk about knowledge, attitudes, and practice concerning menstrual hygiene management of adolescent girls in rural Malawi. Then we will have Helena, who will talk as well about schools in Cote d'Ivoire. And then we will have our inspiring Ina from What's Uniting talking about the Menstrual Hygiene Day. So a little bit more on our speakers today. We are very lucky to have, oops, what is happening? This is moving, sorry, I apologize for that. We will have 3 very strong speakers with great, vast knowledge and experience in menstrual hygiene. We have 𝗖cie, she's from Malawi Red Cross, she's the director of program, and she has vast experience in the field in menstrual hygiene, and she's one of our menstrual hygiene champions. We will have Helena Goro as well. She's Netherlands Red Cross program coordinator in Cote d'Ivoire, and she has been working, advocating for menstrual hygiene since many years as well. And now she's currently very busy covering COVID. So we are very lucky to have both of them today with us. And then we have the wonder Ina. She is the one who is as well leading in breaking the silence on menstruation since 2014 with What's United, and it's leading globally the Menstrual Hygiene Secretariat. So these are our 3 great speakers and powerful women. So let's go to introduce themselves and to see what they have to share with us today. Okay, but before I hand over to 𝗖cie, I'm trying to move my slide and I don't know what I have done now. Okay, sorry. Can you see my screen, all of you? Oops.
Yes, we can, Alex.
Yeah, sorry. Before I hand over to 𝗖cie for the first presentation, we will run the first poll. The first poll, it's just launched, is which sector area do you work in? So please answer this question, because we want to learn who is attending this webinar today. And I will now hand over to 𝗖cieห์𝘁𝗲 from Malawi Red Cross. So Leticia, perhaps if you want to give the rights to her so she can.
I think 𝗖cie will share her screen herself. So 𝗖cie, whenever you want to, please feel free.
If you perhaps, 𝗖cie, put your video as well to. Thanks.
Yeah. Can you stop sharing from that side so that I can share from here?
Yeah. Now I think you have the rights, 𝗖cie.
Great. I hope you can see my slide.
Yes, we can. Perfect. Now is the first.
All right. So thanks very much, Alexandra and Helena. Hello, everyone. Allow me to turn off the camera so that I can have a strong network. Otherwise, I'm happy to be making a presentation. I'll be sharing experiences of Malawi Red Cross Society in as far as menstrual hygiene management knowledge, attitudes, and practices is concerned. It was a case study of rural primary schools in Malawi, and the study was done jointly between Malawi Red Cross Society and Swiss Red Cross. Just to give a bit of a background about Malawi, Malawi is a landlocked country that is found in the southeastern part of Africa, bordered by Mozambique to the northwest, and Tanzania to the northeast, in Mozambique, and it is bordered by Zambia to the northwest, Tanzania to the northeast, and Mozambique to the south. It's got over 18 million people. And Malawi, just like any other countries in Southeast Africa, is faced with a lot of menstrual management issues that include inadequate materials in sanitation facilities. There is inadequate information amongst the various populations, including the adolescents. And so there are negative perceptions and attitudes towards menstruation as a subject. And this has had a number of impacts on girls' hygiene, self-confidence. It has also led to absenteeism, low performance in school, and in the long run, there has been a negative impact in terms of the general health and well-being of the girl child. So as Malawi Red Cross Society, with financial support from Swiss Red Cross, we've been implementing a community-based health project in Mzimba and Salima districts, of which menstrual hygiene promotion is one of the interventions. So basically in the study, we wanted to investigate the knowledge, attitudes, and practices around menstrual hygiene management amongst primary school girls and boys in Malawi. We also wanted to identify the associated influencers on these issues among primary school girls in the district. And again, we wanted to identify, or at least find out, the role of boys' knowledge on menstrual hygiene management dynamics, which is usually a widely neglected aspect to date. So as I mentioned, the study was done jointly between Malawi Red Cross Society and Swiss Red Cross. And we did use mixed methods where qualitative and quantitative data was collected. In terms of quantitative data, we had 522 interviews with the learners, and the age range of the learners was between 12 to 20 years, with an average age of 15 years. We also collected qualitative information whereby we used focus group discussions and key informants. So talking about the results, we did find out that the learners in both districts had at least fair knowledge on menstrual hygiene management. And we noted that learners gained less knowledge on MHM in Mzimba than in 𝗖𝗲 for both girls and boys. And 52% of the learners did make mention that they had no information about menstruation before the onset. Again, we tried to find out from the girls in terms of their source of information on menstrual hygiene management issues. And we also established that the source of information in the two districts or between the two regions differed. That is to say, in Mzimba, we found out that the peers and the grandmothers are the main source of information on MHM, whilst in 𝗖𝗲, the mothers and female teachers were the main source of information. And again, we tried to find out the attitudes of the learners. And we also established that both qualitative and quantitative information indicated that the onset of menstruation presented a negative experience for most girls, about 85% of them. And as I mentioned, 52% had not heard about menstruation before. And again, we did establish that girls were seen as unclean, and so they were restricted from many social activities whenever they were in messes. So for example, they were not allowed to participate in cooking, housekeeping, or interacting with boys. We also tried to check the practices in the schools. And we did establish that most of the schools had inadequate menstrual hygiene management facilities. For example, some schools didn't have toilet doors, others did not have functional water systems, others didn't even have soap or dustbins. And again, we also wanted to check absenteeism or the challenges associated with menstrual hygiene management. And we established that the challenges also differed between the two districts. For example, pain and soiling were mentioned mainly as a challenge in Mzimba district, whilst as in 𝗖𝗲, mostly they talked about issues of embarrassment, teasing. So already we felt, or we did realize that the learners in Mzimba were mostly worried about physical challenges associated with menstrual hygiene management, whilst as learners in 𝗖𝗲 suffered more psychological challenges. So in conclusion, what we are saying is that the study did establish that there were differences or variations in terms of the knowledge, attitudes, and practices in the two districts. And the source of information was differed between the two districts as well as issues of absenteeism associated with MHM differed in the two districts. We also established that girls and boys in Mzimba had lower information on MHM as compared to 𝗖𝗲. And we did also establish that grandmothers and peers were key sources of information in Mzimba, whilst in 𝗖𝗲 it was female teachers and mothers. So again, already stressing the fact that the issues differed between the two districts, despite both districts being in Malawi. And as Malawi Red Cross Society, we have utilized the information to inform our programming on menstrual hygiene management. So moving forward in our MHM interventions, what we're doing is we are trying to address the knowledge gap of the learners by targeting existing sources and influencers. So in this case, we are saying we need to set interventions based on the issues that are coming from their ground. We need to look at the different influential groups in the areas that we are targeting our interventions with in the two districts. And again, we are saying we need to provide access to reliable and early information to avoid negative perceptions. Yeah. So as I said, we are now reaching out to, for example, girls clubs to talk about menstrual hygiene management issues, because it's a gender issue. And again, we are also including boys. We are involving boys. We also want to make sure that boys have the adequate and the right information about menstrual hygiene management, so that they can also support, act as champions in terms of supporting the friendly environment for the girl learners in as far as menses are concerned. And we also said it is also important to build the capacity of existing entry points, like the mother groups and life school teachers. So at the moment, we are also reaching out to those groups as mother groups, life school teachers, to provide them with the right information, because these are the ones that also interact with the learners in school, and also out of school, they are also able to interact with adolescents. So we want to make sure that these are able to provide the right information on menstrual hygiene management. So again, the issue of not leaving out anyone else. So we need to engage the traditional influencers like the grandmothers in order to involve them in influencing behavior change. So we continue advocating for supportive learning environment during menses. In our interventions, we make sure that we advocate for MHM friendly rooms. That is, change rooms have to be adequate enough. They have to have functional water systems. They need to have at least things like soap, dust bins. And as a national society, we do this jointly with the existing structures at school to make sure that these interventions are sustainable. So some activities like, for example, to ensure available functional water services, we do provide that. But for issues like soap, dust bins, and the like, we also engage the parent teachers associations, for example, so that they mobilize some of these information. So what we are saying is that for us to address challenges associated with menstrual hygiene management, we need to engage the learners themselves. We need to engage the influential groups, in this case, the people that influence the learners or the adolescents' behaviors around menstrual hygiene management. And again, in the school premises where most of these learners are, we need to also interact with the patrons and matrons and reach out to them with the right information. And again, we are saying we also need to promote affordable interventions. And at the moment, we are also trying to provide capacity in terms of producing reusable menstrual pads. So that's just an example of the mother groups participating in production of reusable menstrual pads. In short, this is what we wanted to share in as far as the MHM Knowledge, Attitudes and Practices Survey that was conducted by Malawi Red Cross Society and Swiss Red Cross is concerned. Thanks very much, and over.
Thanks so much, Prisca. Great insights on the experience from Malawi Red Cross on menstrual hygiene. I love the part where you say the participation and as well for sustainability to make and ensure that we are not only giving everything to the target population as well, how we need as well to motivate them to as well contribute. But now I would like to show you the poll before we go to the questions from Prisca. And I think we see some questions already in the chat. I will prefer perhaps if the people, I see Maja, do you want to ask the question with your micro, Hannah? Maya, sorry. And then another, please go ahead.
Well, I can. Hello. My question is whether, because there were the differences between the two regions, interesting differences, and I was asking myself whether this was due to the fact that in one region there might have been a program before addressing the issue. Thank you.
Prisca, do you want to answer or do you want to get all the questions first?
I prefer getting all the questions first.
All, okay. So I saw, 𝗖ecie, there's another one in the chat.
Yeah, sure. I can read them out loud. So we thought it would be good to take 3 questions now, and then maybe we can open the floor to more questions at the end of the 3 presentations. There was a question from Lorena asking where the schools themselves approached on how to implement MHM and WASH best practices, so meaning training or assessment tools. And then there was another question, Priska, on what materials were used by the girls during menstruation period, like pad, cotton, clothes, or both. So these are the 3 first questions, and then maybe we can take more at the end of the presentations. Thanks.
Thank you very much. The 3rd question, can you just come again on the 3rd question before I start responding? The 3rd one,
so it was about the materials, the pads materials that were used by the girls during the menstruation. So if it's pad, cotton clothes, or both.
Okay. Thanks very much for the question. The first question was asking if the differences in the practices, the knowledges in the 2 regions was a result of probably an existing project before. So the answer is that these 2 districts were under the Swiss-funded project in the same year, meaning to say that, of course, before Red Cross was not yet there. However, in terms of existence of information on MHM, when we started to interact with the learners, we did learn that there was an NGO before that also had started working on menstrual hygiene management, that was in a way providing some information to people around the district of Salima. And again, we are also attributing the differences to the very same reason that the schools in, for example, Salima, their curriculum had to some extent incorporated MHM issues as compared to Nzimba. So that was also in a way attributing to the differences in the finding. And again, if you also look at the sources of information themselves, you will see already that Salima, they had reported that some of the information was coming from the female teachers, meaning to say that at school, they were somehow exposed to that information as compared to Nzimba. So when we came in with our project, we wanted to make sure that we provide adequate information, reaching out to everyone else. And again, if you look at the figures, although we are saying there was fair knowledge in terms of MHM in the 2 districts, with one district being more knowledgeable than the other, still more, the percentages were around 40-something to 60-something, meaning to say over 40% did not have adequate information. So the gap was still there. Yeah, I hope I've answered the first question. And then the second question is saying where the schools approached on how to clean or at least get the various facilities that will support menstrual hygiene management issues. Thanks for that question as well. The main purpose, one of the purpose of doing the study that we did was to make sure that we really get the real issues that are surrounding MHM in the schools. So as I did make mention that we did establish that most of the schools did not have adequate facilities to support menstrual hygiene management. For example, the issue of soap, the issue of not having functional water systems, the issue of not having dustbins. After we had done the study, we were making follow-ups in the different schools. So we were trying to address the issues per school as per how the issues came in. So we didn't want to sort of come up with a standard kind of intervention, but we wanted to make sure that we treat the issues as per their study findings. So the answer is yes. We supported or we engaged with school authorities to share the findings with them and also to discuss with them to co-create solutions for the problems that we had identified. And this is where we also agreed with them to say, as Malawi Red Cross Society, we can be able to advocate for things that the communities are not able to get. For example, the borehole, to make sure that, for example, a school that didn't have a functional borehole. As Malawi Red Cross Society, we did then discuss with Swiss Red Cross to say, can we then rehabilitate, for example, an existing borehole, or we need to bring in a new borehole to make sure that there is a functional water system. But then for issues like soap, dustbins, we also engaged with the school committees to say, can you then look at how you can mobilize resources to get this? Because as an organization, as a project, we will come and go, but these interventions will have to continue. So the answer in this case, in short, or to conclude that, we are saying the solutions were developed or generated jointly between us as Malawi Red Cross and the schools concerned. Our role was mainly to facilitate the practical solutions to the problems that we identified. And then to answer the third question, in terms of what kind of materials did you provide to the learners? As a project, we provided reusable pads, but again, we did teach the learners, or I should say, maybe before we came in with the project, the findings of the study did establish that most of the learners were using like cotton cloth as something that would cover, or that would be used whenever they are menstruating. So mostly they were using the cotton cloth. Very few, about 30-something%, were able to buy the non-reusable pads. So again, we did establish that the issues of affordability of the non-reusable pads came out as one of the issues that would affect, or that would at least support in terms of deciding on what interventions we needed to bring to the learners. And then we needed to make sure that the solutions are indeed acceptable as well as sustainable. That's why we started training the mother groups in the production of reusable pads, and we did give them a startup material for that. Afterwards, they continued making reusable pads on their own. Thanks very much. I think I've responded to the 3 questions.
Yes, Priska, you have. Thanks so much. Indeed, there are coming a lot of more questions in the chat, so you are on fire with the question. But as we say, we will capture more questions at the end if we are able to. If we are not able to answer this, we will capture and send response in our community of practice group, because I see there's a lot of other questions coming. But we need to move to the next presenter. I will only show you now our polls results, the first one that we launched. So I don't know if you can see that.
Yes, we can. Thanks.
Perfect. So who attending, which sector area are the attendees from this call? We have 34% are WASH, 27 health staff, 14 protection, gender and inclusion, and we have as well disaster management and other sectors. So wonderful. It's great that we have different sectors joining our webinar. And we will run the second poll of questions before I hand over to Elena. And really, thanks so much, Priska and Malawi team for your great presentation. So let's run the second poll before we start. The second poll is about, let's see, hold on one moment. Letizia, I cannot see this. Okay, yes, let's do that. Launch the polling. So the polling, it's okay. It's what tools do you usually use to conduct menstrual hygiene assessment? You can it's multiple choice. You can see focus group, CAP surveys, key informants interviews, Oda, tell us more. Okay, thanks. So we will now hand over to Helena Goro. She's from Cote d'Ivoire. She's going to give us her presentation. Over to Helena.
Elena, are you there? I think you have to unmute yourself.
Sorry. Okay, thank you. Hello to everybody. It is a pleasure for me to present our case study, our experience in terms of menstrual hygiene management, titled Designing a Wash in School Project with an MHM component in Cote d'Ivoire. Next. Okay. This project has been, as you may see, it has been financed by the Netherlands Red Cross, which has also provided technical support, technical and financial support to support Croix Cote d'Ivoire in conducting this project. So the presentation plan is as follows. Next. Okay, so we conducted this Wash in School project in Dimoko district from January to December 2020. And the project covered 15 public primary schools, covering 28 villages. And the population of this target area is estimated to 13,190 persons, which gave us 14.5% over the total population of the Dimoko district. Next. Next. Okay, before conducting this project, implementing this project, we conducted a CAP survey covering the 15 primary schools of our target area in February 2020. And this case CAP survey gave us the following findings. With regard to social and cultural aspect, we noticed that the topic is not a strong taboo within the community. However, the girls are not so keen to discuss the issue openly. Menstruation is also associated to fertility. With regard to access to facility, when girls are menstruate, they will go home during the break at 10 a.m. or at lunchtime to change the pad they are using. And for the health, with regard to the health aspect, most of the girls interviewed reported to have pain during the menstruation period. However, the few of among them have access to tablets to relieve their pains. Most of them will use traditional medicine to relieve the pain. Next. For the material, we noticed that the girl use disposable pads. The most used brand is Vania, or some of them use hot fabric to protect themselves. And they will change that into the toilet of their home or in their shower. And they use disposal towel is thrown into the bush or in the latrine pit of the latrine, or is buried into the ground because they don't want people to see it. So the girls who are using the reusable cloth, they wash them with soap and bleach, and they will dry it into the room and cover it with another cloth for nobody to see it, because they are ashamed for, they don't want people to know that they have in their menstrual period, mainly the boys or their brothers. For the school attendance, when they menstruate, they will come to school. Most of them will come to school. Only few reported that they could not come because they have the pain is too serious. Most of the time, the girl reported that they receive information from their mother, the sister, the female relatives, but not at school because it's not part of the curriculum. Next. Next, please. Okay. This funding helped us to develop the project around 2 key objectives. The first one is to increase the access of proper sanitation facility. And the second is to integrate the MHM within the curriculum at the school level by training the teachers and creating MHM forums. Next. Next, okay. Okay, so we in Cote d'Ivoire, the MHM is well addressed in policy and strategy. And we have a national washings, a 3-star approach, which has been put in the guide. So here we have a working tool, which is a 3-star approach. And this 3-star approach is supported by UNICEF, by the Ministry of the Education and Ministry of Health. Next. Next. Okay. For the implementation, as part of the implementation of this project, we have trained the teachers and the school management committee for them to implement the 3-star at school level. So those trained persons have developed a plan of action to implement the activity. We also built a girl-friendly latrine to help the girl to change the pads when they menstruate. But most of the successful approach within this project is the MHM forum. Because those MSM forum has been set up in each school, and they are a safe place where girls can meet regularly and discuss about the menstruation, personal hygiene, and sexual reproductive health, because this is new for them. And the forum are chaired by female teachers who have been also trained and coached to use the 3-star manual to lead the forum. Next. Okay, so when we discuss with the teacher, they taught us that those MHM forum gave them more confident to discuss with girls, because the MHM topic is not part of their school curriculum, so they could not address those issues with girls. But thanks to the forum we set up and the training they received, they are now able to discuss that in a trustful manner. Okay. So we noticed that the MHM forum have been well received among the girls, because it is the only opportunity given to them to discuss their teenager life, the issue they are facing in their teenager life. Also, we noticed that it is important to have the person who is leading this forum to be a trustful source of information, because the girl don't want what they are discussing during the forum to be spread at the community level or school level. And it is important for the person who is leading that to have a trustful information to provide to girls. Next. Next. Okay, so we already said that the MHM forum as a safe place for girls to discuss with teachers who can provide them the useful information. Next. Okay. But we also face challenges during this implementation. We have some challenge in this implementation. The first challenge is that we set up MHM forum, but the material, we are not sure that the MHM forum will continue having material when the project will end. And it also requires a great investment in terms of a latrine building, in terms of water point building, such as borehole, to give access to water to those girls, mainly when they are in the menstrual period. We also, before implementing this MHM forum, it is to train teachers and also the school management committee, because they are the ones who are in charge of implementing this approach, because they are much in touch with the students. Next. Okay, thank you. So you can see some pic of the lab training we built under the project. We have two blocks, a block between one part for girls and another part for the boys. Next. Next. Okay, you can see here a teacher leading a MHM forum with girls. And she is showing the three approach manual I thought about. She is using that manual to lead this forum. Thank you for hearing our presentation.
Thanks so much, Helena. If that's okay for you, we're gonna take a few questions now. And then move to the next presentation and the presentation of the polls. So I am going through the chat, and I can just pick up on some questions. And again, if we don't manage to cover them all, please have a look at our community of practice at the end of the webinar, because we're gonna try to answer them all there. So there's one from Iran asking, Helena, was the MHM forum limited to girls of specific age, or was it free for every girl to join?
Okay, the forum is open to girls, the teenagers. It is open to the teenagers, those in menstrual period, or those who are not far from the menstrual period, to prepare them to receive this period and manage it smoothly.
Okay, and there's another interesting question from Maja asking, what about forum for boys? Have you thought about it?
No, we did not address the forum for boys, because we were discussing. We noticed the main challenge we noticed at the community level is that girls are facing alone their menstrual situation, because they could discuss that few with their parents. So we thought that it is important for us to set up those forums for them, to give them knowledge on how to manage their situation. But that is a relevant question, because when we recently discussed it with girls, they said that they are not comfortable with their brothers, the male members of their family, because when they have the menstrual period, they could not dry their reusable part outside, because the shame. So we thought that it was important for us to develop a forum for men or for boys, for them to get use of those issues and help girls adopt good practice.
Thanks. Sorry, the presentation keeps going. Is there anyone else that wants to ask a question? Sorry, I'm scrolling, but if you want to take the floor and ask a question yourself, please feel free to take the floor.
Okay, the project is only implemented in primary school because of the limited fund we have.
Okay, so someone from the audience, do you want to take the micro and do the questions?
I think there's a question actually from Priska asking, are the negative perception stigma also coming mainly from grandmothers' peers, and are men and boys, or yeah, we also talked about it already. But she asks a question about stigma also coming mainly from grandmothers and peers. That's a question from her.
The stigma is mainly coming from the boys, because when they see the girls in forum with the teachers, they are curious to learn, to know what are discussing there. And some will hide and have to catch some words. And when they will go with their friend, they will start discussing and laugh about that. So some girls are not comfortable with that situation.
Thanks so much, Helena. Thanks for the great presentation. And I think we can see connections between Malawi and Cote d'Ivoire, but we see as well great difference. So I think this is a challenge, and this is the challenge with menstruation. I mean, it's so personal, and it's so in different countries, different districts. We continue to see there huge difference that we need to consider and we need to learn before we start to implement. So I will now launch the results of previous poll. I don't know if you can see. So we asked the question, what tools do you usually used to conduct menstrual hygiene assessment, and 71% answer focus group, CAPS 55%, we have key informats as well 43%, and 9 other tell us more. Okay, so before I move to the next presenter, we would like to do the third poll. I will do the fourth poll. Sorry, I'm changing now. I will launch this polling before Ina start her presentation. Have you ever celebrated Menstrual Hygiene Day? No, yes. So you have 4 questions there. Yes. Let's maintain this poll open, and I think 𝗖ጽיה, let's give the floor to Wanderina.
Ina, yes. I'm giving you the remote control. You should be able to move the slides yourself.
Thank you.
Sorry, the name is Sina, but I call her Wonder because she's like Wonder Woman.
Like we all are, Alex. Don't you're too. So yeah, thank you to you and 𝗖ጽיה to give me the opportunity to present on the plans for Menstrual Hygiene Day this year. The IFRC is a key strategic partner for Menstrual Hygiene Day since years, and celebrated and supported the day, and also now through this webinar. So thanks a lot. I will use often the short form MH Day instead of Menstrual Hygiene Day, and MHH for Menstrual Health and Hygiene. So I'm just figuring out how I move the slides. I can't. Okay. So Did I do this now? I'm not so sure. 1 second.
Yes, I think you are moving, Ina. No.
Okay, but it's not moving like I click.
It's very slow, so it's very slow.
Ah, okay.
Sorry.
No. Yeah, so that is not yet the slide, but I can talk to it. So yeah, as I said, you've celebrated in the.
Yeah, do you prefer me to move the slides for you? Or
yeah, that'd be great, because I'm already now 5 slides in, and it seems.
Wait, I can move them for you. No worries at all. Wait.
Okay, perfect. Thanks.
Let's just go back to the beginning and start again.
Oh yeah, now it moves. Okay, so you can skip to the next slide. So what I will talk to you, and thank you also for this poll in advance, Alex, because we've seen some of you haven't known about MH Day and so on. So I hope really to ignite you today to celebrate also MH Day this year. So I will give you some inspiration from last year. I'll share with you the overall narrative for this year. I present some of the materials you can expect, and particularly how you can join the menstruation bracelet action. And as we're still 2 months ahead of MH Day, I really would like to take this also as an opportunity to share with you ideas and questions and have a discussions, because there's still room for you to influence what we're doing based on your needs, and also give Alex and 𝗖ție some good hints how they can support you. So we're here for you. So let's dive right in. Next slide. Last year has been really an unpredicted and very challenging year, as we all know, for us personally and as an organization. And as we started, we really didn't know if MH Day would happen, but we actually got the feedback that no, quite the opposite. It's really important, because periods don't stop for pandemics. And that was also the call that was shared very, very widely by all of our partners last year on MH Day. As you can see, if you click, 𝗖ție, you'll see some examples how partners also took up the message, and we were really heard loud and clear last year. If you move to the next slide, you can see also some examples how partners celebrated MH Day. Some events were still possible on the ground, like you can see in Papua New Guinea, and also people start to be a little bit more creative than in the last year. So for example, doing lighting of a bridge in red, so where you could watch from afar. Many organizations celebrated now online, like they hosted lots of online events, even with the government in Ghana, for like advocacy purpose, education purpose, and just practitioner exchange. And in the middle, you see also the call from IFRC, like as every year we mark Menstrual Hygiene Day, and the very great, really one of our favorite video that the Malawi Red Cross Society has done. So maybe 𝗖cie, you've been also in the video. Let me know in the chat box. We have more and more governments also joining, even if it was difficult. So we had the World Bank making a statement. The Fiji government in Kenya launched its national policy on the day. Next slide. And to our surprise, MH Day, despite the pandemic, was bigger than ever. So we had really an overall 411 million people were reached online. And as you could see, that increased from the previous years, because yeah, really people mobilized online to tweet and post. And that was really unexpected and amazing to see. Next slide. So with that in mind, we're really looking forward to Menstrual Hygiene Day this year. If you move to next slide. Oh, I hope you can read. So again, we see that this year is critical for menstrual health and hygiene and gender equality more general. Because we all know, and you've discussed and shared, that the pandemic has highlighted and really exacerbated or worsened menstruation-related challenges for women and girls. And overall, the pandemic has really hampered and in many cases even reversed progress over a more gender equal world. So that's why, if we move to the next slide, for years this year, our call is really that as the end of the COVID pandemic is slowly getting inside and lockdowns are releasing, it's absolutely vital that menstrual health and hygiene is adequately addressed in post-pandemic recovery plans at all levels and in all sectors. And we really, to make this happen, I mean, there's a lot of programs and activities going on and they line up, and we don't want that menstrual health and hygiene is sidelined. It maybe not prioritized, but at least it should be mainstream, because we know how important it is and how menstrual health and hygiene, as you presented before, contributes to education, health, well-being, and agency of women and girls. So this is the broad call, so post-pandemic periods. And there are some specific calls to action. So we need more action investment in MHH education. So every girl has basic knowledge around menstruation. Can you click through, Laetitia? So we need more action investment to end period poverty. So that is basically access to affordable menstrual products that every woman can choose from. Next click. And overall tackle period stigma, as it was also presented. This is also really hampering progress and just a well-being and by every woman and girls. So we are confident that there are solutions out there. There are organizations willing to scale. We just really, at this point, we need action and investment. Therefore, it's time for action. Next slide. So we always use MHDay 2021 as a hashtag, and it's time for action. And really, my call to you is to say, let's call for action investment in good menstrual health and hygiene in post-pandemic recovery together, because the more clearly we speak with one common voice, the louder and better is this message heard. But then beyond that, you're flexible. I mean, depending on where your country focus is, and if it's like period poverty, education, wash infrastructure, as was presented from Sierra Leone, or MHH emergencies, you can tie it to this overall call.
Sorry, hold on. Can we just participate or say our opinion after you're gonna give?
Yes, afterwards. Yes, we have a question and answers afterwards.
So thanks a lot.
Okay, can you press, Laetitia?
Yeah. Hello, everyone.
Can you mute yourself while I'm presenting? But hi, nice to meet you. Everyone is muted so far.
Oh, wait. Is it good now?
No, you're still, okay. You can.
Hi, sorry, you need to mute Khalid, and you can put in the chat where you are. Thank you.
No.
So we're looking forward to, we're looking to develop a third hashtag that relates to periods post-pandemics, kind of. If you have ideas for good slogan or hashtag that relates to it, please share in the chat box. We're really still brainstorming, and it would be great if you could contribute to that. Okay, next slide. Like every year, we produce some great materials. Last year, we created this by different artists. And these are examples from last year, but what we'll do again this year is we'll have artists that create very inclusive graphics. They will be text in Arabic, English, French, German, Hindi, and Spanish, and maybe Portuguese, we'll see. And there's always space to add your logo into the materials. So from your either organization or from your national society, there's this white space. You can add your logo. You don't have to design your own. Next slide. We're developing also an infographic or maybe a roadmap. We're still thinking related to periods post-pandemics, and a video with the movement. These campaign materials are usually ready by end of April or first week of May. And I will definitely share them with Alex and Laetitia to share with them widely. I post them once they're ready into your community of practice, so you can see when they're ready. Next slide. If you cannot wait, there's also always an opportunity to just use the logo to create your own design. We'll have a design guide. And here are some examples, like Malawi used just the logo in their video and the hashtag, and here are some other examples. So it's really important for us, no matter what you do, just use the logo and the hashtags in your content. So that increases the overall relevance and reach of the collective efforts. So we're again speaking in one voice. Next slide. But there's one thing that you can already join now and on MH Day. So this is the menstruation bracelet action, as we call it. The menstruation bracelet is really a global symbol for menstruation. And similarly, like, you know, the symbol for HIV/AIDS is the red ribbon, or the rainbow flag is for LGBTG. So this symbol is really, you can wear it on MH Day, but also every day to take a stand. It stands really for the joint commitment to create a world where no woman and girl is kept from realizing her potential because she menstruates, and just a normal fact of life. You can see it's 28 beads, thereof 5 are of different colors, like 28 May, very easy to remember. By wearing the bracelet and sharing a picture on it, you show that really periods are nothing to hide, and help to end period stigma, because one picture at a time, because you really don't shy away from talking about it. Next slide. We introduced the bracelet kind of really last year, and it was really great to see that it works really across cultures and geographies. As you could see, so many different countries who joined by wearing the bracelet. Next slide. But even more important is that it's really possible to be creative and express yourself with whatever you have. So yes, a bracelet with beads would be great. You can also use different colors, as you could see on the left side. But people created the bracelet with all kinds of materials, and there's no description. So here you see a bracelet made from just simple paper and painted. People used cut out paper and painted it. Here is an example with different kind of seeds, or creating image with balloons, flowers, chilies. And on the right side, you have an image from a partner, I think. So she glued just simple peas on a double-sided Scotch taper. So whatever you have at home, you can create the bracelet. So that was really fun to see all the different versions that people came up with. Next slide. To help you doing this, it's really super easy. So of course you can make a bracelet yourself. There's a video and some guide. We also have a template that you just print out and you can cut, and then you can color in. But we also have digital bracelets, mostly for Instagram or for other photos, that when you take a photo, you just add this animation to it, and that's it. So not even needing to have a physical bracelet. So we try to make it very, very easy for you, and we have a guide for you on our website. Next slide. So I just want to share how you can really use the menstruation bracelet in your national society as your representative or as an own organizational individual. So there are 4 ways, which you can do all, or you just pick 1 or 2, that doesn't matter. So the easiest, actually, what we think is engage your colleagues or your organizational staff and your leadership. So this is within your own organization. And then externally engage your social media followers and influencers. We talked about the importance of influencers this morning to break the stigma and overcome negative social norms. So this you can also do. and engage political decision makers. I will show you some examples how you can do it on the next slides. So here is how you could join your colleagues. You just ask them to take a picture wearing the bracelet. You can collect the bracelet and make a nice collage. Here we have the GIZ and Kimberly Clark. You can also add a call to action if you want. So that's easy. And a small tip is maybe set yourself a target. So I want 20 colleagues to join. So as easy as that. Next slide. Here are examples how you could engage your leadership, your UNFPA or Water Aid in Myanmar. You just also hand over a bracelet, they post a picture, you post it on their channels. You can again ask your organization leadership to take a call to action with the picture. And here's an example from Myanmar, or even make a commitment to action, meaning we as Red Cross South Sudan, we're going to work in 15 schools next year. Could be an example. Okay, next slide. And of course, engage your social media followers and influencers. Just ask them to also create a bracelet and post it. It's really fun. And if they use the hashtags, we can also find them. I hope that this year you're also able to hold on the grounds event again. So why not doing a small session to create your own bracelet within one of your education sessions, or when you have distribute the bracelet when you meet with different kind of stakeholders. So as easy as that, and it's a great conversation and program starter. Next slide. We've also seen that the bracelet is a very, very nice tool to engage political decision makers. And here you see an activity we did with German MPs, some other political decision makers like different ministers and state secretaries took a stand. And it's really easy for them. And yeah, we hope when you work with governments and decision makers, you ask them to wear the bracelet, to take a stand, post it on their channels, not only on yours. So that's even more important. And depending on how engaged they are, I think Malawi is already, for example, quite ahead with being engaged in MHH. You can even ask them also to make a commitment. So very easy, depending on how they engage and want to engage. But it's very beautiful, I would say. Next slide. And that's already coming to the end. Oh no, there's some mess up on the slide. So sorry for that because of different computers. But so as a summary, that's a summary. And my ask to you is, yeah, please join the bracelet action and send us your images. If you do call to actions and commitments, we really would like to know. Use the MHD hashtags when you post on social media. If you do an event, also let us know, because we're collecting and sharing this widely. And if you do something very, very nice, we of course share and amplify what you do. And yeah, I hope you, with this presentation, you will join us next year. On the next, and the second next slide, there's my contact details, how you can reach me. Through our social media channels, and we also have a newsletter that you can subscribe to when you just simply go to the website. Thank you. That's it. I hope you enjoyed the little presentation.
Thanks so much, Ina. It's great presentation. As you say, all together, if we take action together, we are much stronger. So it's great, you know, that we as the Red Cross movement, yeah, can join, you know, the actions that the Menstrual Hygiene Secretariat is doing for Menstrual Hygiene Day. So I think it's fantastic that we share already. It's March, so we can get prepared for our support on the Menstrual Hygiene Day for 2021. Yeah, Thanks so much. And now we have, we can open the panel, we can open the microphones if really, you know, our national societies or any other persons that is in attendance want to do direct questions to Ina. Yeah, please go ahead, raise your hand or take the microphone, please.
I can see one question about where the bracelets are available. And thank you for this question, Mahesh. So the idea is that you just create the bracelets yourself. So as we shared some examples, they don't have to be beads. They can be made from any local materials that you have available. If you are looking for the paper format or the digital GIFs, so the digital images, they are available on our website. But the rest you can just create them yourself with your team.
Thanks, Ina. I'm also scrolling through the chat, and I see that Alex from Austrian Red Cross is sharing some very interesting information. The Austrian Red Cross is organizing a public event or a panel discussion, actually an exhibition about MHM on June the 2nd in the west of Austria, close to the Swiss and German border. So if anyone is interested in collaborating, please feel free to reach out to Alex. That's a very cool initiative. Thanks for sharing, Alex.
It's Alex, Austrian Red Cross. Please not confuse with.
Yeah, exactly. The Austrian Alex.
Yeah. So Alex, please put in the chat your email so they can contact you. It will be great. I see Libertad. Do you want Libertad to take the microphone and ask? Because I see, or is this about in a presentation? No.
I just can say we have also the presentation. I mean, these will be shared. We have them also in French and Spanish early next week. So for those of you, so for everyone to be on the same boat, even if English is not your first language.
Great. And as Ina said before, we have our menstrual hygiene community of practice is in the e-learning platform. We will share with you the links, but as we said before, all these presentations, the recording of previous webinars, the PPTs, and as well answer and questions from these webinars will be there. It's as well other things coming. It's not only these webinars, other webinars that are important from menstrual hygiene are there, and as well if there is some kind of call of proposal and other things. So what we want there as well is that you guys share your national society experience with us there as well. Yeah. So everybody's it's open to download as well and to upload things. So any other question for Ina? If not, we can present the polls results.
Alex, I think there's a question in the chat which is interesting that asks Ina how we can motivate actually people to do some MHM bracelets.
Good question. Actually, I think it's because it's quite. We see two things. One is because it's very, very pretty. People are just like, if you wear it, you're just asking, oh, what are you wearing? And then you explain, and then you hand over and ask people to say, yeah, do you want to join the call to end period stigma and take a stand for menstruation, because we need to talk about it. And then people usually say yes, because it's a very pretty, easy symbol. If you want to, my tip, if you want to mobilize your colleagues, your staff, it's good to start also with the leadership, because then, or involve your leadership, because then many will follow. In terms of more social media followers, I missed to share a super awesome idea from one of your colleagues in Myanmar last year. She set up a Facebook page and asked really her colleagues, her friends to post pictures. And the more picture came, it also motivated more and more people to join and share their version of the menstruation bracelet. And she had amazing stories of grandmothers doing it for their granddaughters. The Facebook page is down, otherwise I would have wished to share it. So yeah, there are different ways, but once you break the ice, people are really glad to wear it.
Thanks. That was very helpful. So we're just going to give the last chance to anyone who wants to take the floor. If you have any questions for Ina, please take the floor now before we proceed to the poll results. Thanks.
Hello.
Yes, go ahead.
Yeah.
Yeah, how are you doing? First of all, hope you all doing good. I'm Khalid Yunus from Mercy Corps organization in Iraq, in Kirkuk City, wash supervisor and waste management removal supervisor. We work in city of Kirkuk as a part of our projects in COVID hygiene promotion. So we started in many sectors, many locations in Kirkuk to make the promotion, and we're doing good job. And probably we finished the schedules areas, let's say before the schedule time in many weeks. That's why we had a lot of time to make another trial of hygiene promotion in the same place, and this gave us good time to make a monitoring and evaluation to the results that we do it as a work in the place, and we hope this problem or this health problem is gonna be finished as soon as possible in the world. Thanks a lot for you, and appreciate that for you.
Thanks so much, Khalid, for sharing the work you are doing. Really great, and in a situation like Iraq. Thanks so much. Okay, so we now think we want now to end the polling. We want to share the results for the poll from have you ever celebrated? Okay.
Please mute yourself. Just remind to mute yourself.
Sur du ski, non. Il y a boulot, hein.
Okay, so let's share the results of have you ever celebrated Menstrual Hygiene Day. We have in a 26% of the people that it has still never heard of it, and I think from this from your presentation it's really great. Also, this 26 now they will be really sure that they heard already. And already 35, yes, they celebrate and they organize some events and creating reports. So it will be great that these people as well share with Ina and with us what are they doing, so we can as well, put in social media and share with others. So we will now do the last very quick poll for all of you. The question is, what are the important components to consider when planning an menstrual hygiene management intervention? Is this wash infrastructure, menstrual hygiene items, or information? So please go ahead. In the meantime, I think I will pass to, I think this is a very easy poll, so I guess we will run it very quick. And then I will pass to, okay, we have the 56% have voted, 60%, and I will pass over to 𝗖ție. Okay, great. So I will end now the poll and share the results. Voila. 80% say yes. The three components are very, very important. Thanks so much. 𝗖ጽיה, I think I hand over to you for the
take-home messages. Yes. Thank you, Alex. So this last poll is actually related to one of our take-home messages. Sorry, yeah. So yeah, before letting you go, actually, we wanted to share a few messages that are actually related to the three presentations that you heard about today. The first one is really understanding the sociocultural context is key to designing and implementing successful MHM actions. So as we saw today, for instance, in the presentation of Malawi Red Cross, we saw that in the same country, different places can lead to different results in terms of MHM preferences or MHM, who is the main influencer in taking MHM decisions. So really understanding the sociocultural context is always key to then make sure that we address really the MHM needs in the best way possible. The second point we really wanted to highlight is that creating safe spaces for girls for discussion and mentoring on MHM is key. We saw it in the presentations today as well. Unfortunately, MHM is still an issue that we don't discuss enough, and creating safe spaces in certain contexts allow this conversation to actually take place. So please bear this in mind. The third point is actually related to the poll that we just launched. So MHM is a cross-cutting issue, as we know, and so please make sure that all your projects address all key components, which are access to wash infrastructures, MHM items and materials, as well as information. Of course, all of these aspects are all important, but when you address them all together, you are sure that really the MHM project will address MHM needs in a holistic way. The fourth point regards the fact that inclusive wash facilities can bring huge improvements in dignity. So indeed, we just saw that access to wash infrastructures is a key component of any MHM program, but making sure that these wash facilities are actually inclusive will really make a big difference. So please make sure, to always remember, for instance, to put locks, or to give, to make sure that there is light in all the wash facilities, because these things really make a difference for women and girls. The fifth point is take advantage of global MHM events, because stronger voice on MHM can really support change in national policy. We saw this also with our case study on Nepal, that was presented last month, but Ina really made a strong point on this today. So let's really please take advantages of the MHM events that already exist, because we need to make our voice stronger on this topic to make sure that it's really addressed in our everyday life, in whatever context. Then the last 3 points, the first one is really, while conducting assessments and of course monitoring, always use a mix of methods to allow deeper discussions. So of course, quantitative analysis is fundamental in all the assessments and the projects that we implement, but always bear in mind that, for instance, adding a qualitative analysis in the project will make sure that you really hear about what is the opinion and what are the needs of the women and girls you work with. So please always consider to use both type of methods. Then, of course, men are important for successful MHM. Involve them at every step of the program cycle, and I would add from the very beginning, because this, of course, will allow to raise awareness and also to make sure that they help women also fighting stigma around MHM. And finally, something that really comes up every time, privacy is a key aspect to consider when you conduct any MHM project. So just make sure that it's something that you take into account when you want to implement any MHM project. So these are really our take-home messages for today. I just wanted to share one last information, which we have been sharing throughout the webinar today, which is the slides that you have seen today and the recording of this webinar will be shared not by email this time, but will be shared on our menstrual hygiene community of practice. So if you really want to have access to it, you will need to log in to our learning platform. I think Frank is now sharing on the chat how to log in there. So there's a link. If you're not a member of the learning platform yet, no worries, because it's a free platform and you won't only have access to this menstrual hygiene community, which is fantastic, but also to much more in terms of trainings and many others community of practices. We also have a WASH network if you're interested. So join it for our slides, but also for much more. And I just want to thank you all again for taking the time today to join the webinar. There's going to be another webinar, the third one, on the 30th of April. So stay tuned because we're going to send more information and the invitation early April. Thank you so much.
Thank you.
Thank you, everyone.
Thank you to the speaker, Priska, Helena, and Ina. You're fantastic.
Thank you, everyone. Bye-bye. See you next time.
Thanks for all the participants to join. Bye.
Thank you, everyone. Thank you very much.
Okay, bye for everyone. Goodbye. God bless you.
Goodbye from Equality Summit, Nigeria.